and then I need to record. Or that's being done. No,
Welcome to today's, yes, you're all set. Welcome to today's webinar, everyone. We're going to give folks just a minute or two here to get into the room, and Charles is going to start our live streaming in our Activity Strong Facebook group. Just remember, for CEU credit today, you do need to be logged into the Zoom room. So we're going to give it 1 minute more, and then we'll get started. Thanks for joining us.
Here we go.
All right, good afternoon, everyone, and welcome to today's Link Senior webinar. Today, we are providing one free NCAP and NCCDP CEU credit. We are not offering NAB CEU credit today. In order to be eligible for the CEU credit, you do need to remain on this webinar for the full hour. The Zoom meeting room will track how long you remain in the room and send that as a digital report to me. We are not able to provide CEU credit to people who join only by phone. You must be logged into the Zoom room. At the end of the webinar, I will provide the required post-webinar survey evaluation link in the webinar room chat box, and we'll also send it by email this afternoon. So please check your spam folder just in case it lands there. If you don't receive that link to the CEU survey later this afternoon or through the chat box, please do send me an email. I'm copying and pasting my contact information into the chat. And remember that you need to fill in that survey no later than midnight this Thursday, July 30th, to be eligible for the CEU credit. And if you're not looking for CEU credit today, we do still want your feedback, so go ahead and fill out the short survey as well. This is a reminder that CEU certificates will be issued by email on Monday, August 3rd, next week. And again, please check your spam folder for that. Today, you'll also be receiving a PDF of today's slide deck and a recording of the webinar by email this afternoon. And as I mentioned earlier, we are live streaming this event on our Activity Strong Facebook group, but for the CEU credit, you must be logged into the Zoom room. Now I'm going to hand it over to Link Senior CEO and co-founder, Charles D. Vilmorin.
Thank you very much, Megan, and welcome everyone to our first official Activity Strong webinar. So the title of our presentation today is COVID-19 and Resident Engagement. Hear from Resident Engagement Champions. And these champions, as you can see, are Melissa Dillon, Director of Garden House with Merrill Garden Senior Living, and Jill Mchenrick, Connections Director at Juniper Village at Brookline. The first thing I want to do is thank you. Thank you, Melissa. Thank you, Jill, for taking time off your busy calendar to take the time and share some of your stories. I'm personally very, very excited because ultimately, as much as we can be talking about resident engagement, I think that the most valuable way of learning and understanding what is going on, especially as we navigate this COVID-19 pandemic, is really to hear from the people actually doing the work. So again, thank you, Jill. Thank you, Melissa. As we get started, I wanted to take just a couple minutes to give you some background on these webinars. So as you might know, Link Senior has been providing webinar free of charge to advance the field of resident engagement, activities, and life enrichment. And we've done that actually for more than 2.5 years. We do this simply because we believe that the more the activity and life enrichment director is educated with the best quality educations around, the better the life of the residents. So it is our commitment to the industry as a way to give back and advance the quality of the life of residents in senior living and long-term care. We've been extremely fortunate to have fantastic speakers, including today's. And a lot of them, believe it or not, a lot of them have been because of requests. We do love to listen. We read every single line of feedback that you provide, and a lot of it has suggestions. So if you feel that there's either someone or a topic that we haven't done or we should repeat, please let us know. It is extremely important for us to know what's on your mind, good or bad, so we can improve. As the CEO and co-founder of Link Senior, I'd like to give you a little bit of insight on who we are. So I founded the company 13 years ago, and we provide a resident engagement platform to help the market engage the residents in a person-centered way. So we provide technology, education, and human touch to help advance activity and life enrichment in senior living long-term care. Very proud of our work, and actually it's been published in a peer-reviewed journal late last year in September with very meaningful outcomes around not only measuring quality of life, but also clinical and financial outcomes. And some of you might know us also as the people behind the Old People Are Cool campaign, because we all believe, I believe, and I can tell you that Jill and Melissa, a lot of you also believe that one of the things that our society is not really good at is respecting and dignifying the older adult, and we believe that everyone is cool, including our residents, including the older adult. So Old People Are Cool, and feel free to visit its website. But we're also the people and organization behind the Activity Strong initiative, which started in the light of COVID mid-March. And the sole purpose of this initiative is to acknowledge how essential activity and life enrichment directors are, and to educate you and the discipline, and also to empower with different sets of tools. Some of these tools are educational, such as the Activity Summit that we did back in June, which was super successful. And I do want to mention the fact that we have entered a partnership with NAP and NCAP, and we will be doing more of these events, such as this webinar today, and also quarterly, think of them as mini summits. They're going to be gatherings of 3 hours, and here are the time slots. So I highly encourage you to go to activitystrong.com or on our Facebook page if you haven't done so already, and consider these events. So as we advance the field of activities and life enrichment, it's really my pleasure to bring you today to true leaders when it comes to the discipline, right? And these are Melissa and Jill. And the reason why I'm excited is, again, as I said, hearing from the people actually doing the work is probably the most meaningful way for us to help you understand how you can progress or understand where you are in resident engagement. But also, I love the stories that Melissa and Jill are going to tell us. One, because they're very different. Two, because they've shown extreme innovation, creativity, persistence in their work, and in a way are ahead on a lot of different things. And hopefully this will be a good session for you to learn things and go back and implement some of these things in your communities and working with your teams and residents. Before I do this, before I let Melissa start, I did want to share a few thoughts, which is that, and these are the introductions, is that, you know, I think the biggest thing and probably the most important thing I can do today is thank all of you for the work you do. The work you do in honoring the preferences of our residents is the best way, and sometimes the only way, that we can help these residents live with meaning and purpose, right? And the pursuit of meaning, right, is a basic human right. So what you do is essential, and you are helping our industry, one would argue our society, being more human. So I cannot thank you enough for doing this. But I think that with that, I just want to acknowledge, we want to acknowledge the fact that what you are going through is extremely hard. And I've heard from many many people, including somebody that cannot attend today for personal reasons, that reopening is actually harder than closing. So I know that it's been hard, and I know that for a lot of us, we're not even in a reopening stage, and for some of us that are, reopening can be considered as harder. So I just want to acknowledge that. And with that comes a request, which is to please take care of yourself, right? Like we saw in our previous webinar 2 weeks ago, we had a wonderful topic around self-care. You taking care of yourself will have a direct impact on the quality of the life of your residents, and I'm sure that both Joe and Melissa might touch upon that, but that is my personal ask to you. Now, I do want to share another topic, another thought, which is that social isolation was already an issue before COVID, but I can tell you that by far it has become the biggest topic. Right after COVID itself, it has become the biggest topic. So as much as our work is hard right now, I promise you that the work in activities and life enrichment is being more and more respected by the day. We now know that activity and life enrichment is more respected, and hopefully with that will come more dignifying way for us to work, more tools. And obviously it might take time, week, month, or maybe years, but as we come out of this crisis, I deeply believe that our discipline will be more respected and valued. So I do believe there's opportunities here. And the last thing I want to share with you is, why are we doing this, right? I did say that the pursuit of meaning was a basic human right. You are the one enabling this. Right? Whether you serve 20 residents, whether you serve 30 residents, 50, or sometimes 100 residents alone, you are the link, the person achieving this, right? You are the person helping achieve that for your community, your company, right? Your county, your region, and the country, or however you want to frame this. You are in charge in delivering this purpose to our residents. So again, I want to thank you. And it's with great excitement that I'm going to let Melissa take on this presentation today. Thank you very much.
Well, thank you, Charles, and thank you, Engagement Champions. I really appreciate the time to chat a little bit with each other today. So, hi there. I'm Melissa Dillon. I am the Director of Garden House for Merrill Gardens, which means that I am the home office support person. I work for you in helping all things memory care. I have been in senior living about 15 years now. I started as a caregiver and joined an engagement team. Had the best job in the world as an executive director, and now I have the opportunity to positively affect even more folks out there in senior living as a director of memory care. And Charles asked for me to share just a little bit about my personal story with COVID-19 today, but I don't know if this is necessarily my story as our story of Merrill Gardens. So I'd like to share a little bit with you about what it's been like during this pandemic for my teams, for the residents, and for the family members. Go ahead, Charles. So I'm going to start a little bit before COVID-19 started with us. I joined the Merrill Gardens team in June of 2019. There was a grand opportunity for me to work with a company that was wanting to advance the way that we love older adults with dementia. So we started a pilot program in a few of our communities in Arizona, where we were looking at programming in general, far more than just engagement. What does it look like to have a great dining program in memory care? What does it look like to have a great engagement program that's evidence-based in memory care? What are great laundry programs look like? And so I worked with the Arizona communities through the end of 2019, and we created with each other a whole new memory care culture, is what I would call it. We created new dementia training and ideas and brand standards about engagements and dining and, gosh, what our living room looks like. By the end of 2019, we had wrapped up this idea and named it into a great thing called Inspire Connection. I flew out to the home office, which is in Seattle, Washington, in January. And something odd happened on the flight home where I brought my dinner on board. That's pretty common for a traveler. And when I was finished with the packaging, I went to hand it to a flight attendant. She told me she was not wearing gloves and she was not going to touch it because there was something going around and that I should just put it on the floor. I thought that was pretty weird. So I got home at the end of January, and by mid-February, I was asked to join a call at Merrill Gardens where we were talking about this thing called coronavirus. We do have a community in Kirkland, Washington, and there was another community in Kirkland, Washington, where there were many people that were positive with the coronavirus. Merrill Gardens does have 68 communities in 20 states, and so we needed to navigate what were we going to do about this new thing. And I will be very honest with you, I was one of those folks thinking, this is just another flu. This is, we just need to up our flu protocol and we will march on forward. But I think that we had a little hint of what was happening because we do operate 3 communities in China. And so we had understood what the communities in China were experiencing. And so very preemptively, very progressively, Merrill Gardens chose to start some of these new protocols for this corona or COVID-19 virus. And it's specifically because we were in Seattle. We started asking family members not to join the community, asking vendors that they could no longer come, asking residents to stay in their rooms, eating their meals and having engagement there. And because we were one of the first folks doing this, I think that some of our family members felt odd at the moment. Wait a minute, I hear other people are not doing anything like this, you're being extreme. And it was interesting being a home office team member in this moment because we were asked to create new protocols for a new virus. And how are we supposed to be the champions of someone in a pandemic because none of us have been through it before either? So we got together and honestly did the best that we could. And at times it was confusing. We were asking teams to do one thing one day and then another thing the next. And it was all in this idea of we want to keep the residents and our team members as safe as possible from COVID-19. Go ahead, Charles. So as we were attempting to navigate this, as Charles pointed out, closing down was a lot easier than opening back up. But while we were even closing down, we did have 4 different levels of protocol. Essentially, business as usual, no visitors, stay in your room, and then enhanced resident protocol, which was everything from new cleaning logs to hand washing schedules and all kinds of different ideas of how we could keep ourselves safe from the virus. Quickly, we learned that this was a very difficult thing to do as a unified effort because we were in 20 different states and the rules were different from state to state and from county to county. And so we did need to work very individualized with each of the communities, which started an approval process. And that's where we are now. So all of the communities did go into that highest resident protocol, and essentially if someone for 2 weeks had no new cases of COVID-19 and no new symptoms within the environment, then they may be approved to step down to another level. And every community by community, needed to create a plan that would work for them, because as we know in memory care, we already have some challenges about meeting the person exactly where they are. And now how do we create programs that are going to be specific to that resident, to the flavor of our community, and that fits within the state or county guidelines. We did start weekly calls with the teams and no home office community visits. I think some community-based folks might be thinking, woohoo, the man's not coming. But I can tell you as a person on the home office, it really broke my heart. I am accustomed to flying out on Monday morning to a new state, to a new team, and wrapping my arms around residents and team members, encouraging them about ways that we're going to love someone with dementia just a little bit differently. And I have been in my house since that flight in January, and it's frankly pretty odd. So the way that I could connect with my teams is every week we get on a call and we just have a quick chat with each other. I ask them, how are you doing? How are your teams doing? How are your residents doing? Or have you had any challenges this week? And I have to tell you, it's been a blessing. Generally, I get to connect to a community one-on-one through these flights out to where we are. And now I get to connect every single week, creating relationships and sharing resources and ideas as a group together as a region has been a weird silver lining that has come from COVID-19. There's been a lot of changes in memory care engagement. Some of them are negative, but to be frank with you, some of them are very positive. So some of the hard times that we are stomping through is that no visitors and no vendors. A person living in memory care usually needs to be very connected to their family. They're asking for their loved ones. And to be honest, their loved ones want to be with them. So when we said that we were no longer allowing folks in the community, there was a very weird conversation and balance that we had to have. Excuse me, that is my puppy that I cannot control. We had to ask each other, what is the balance in between keeping someone safe from the virus versus keeping someone cognitively well through the connection and the routine that they are accustomed to having. This also meant no vendors, so no one was coming in to play the banjo or help us through a new exercise routine. And so that meant that our engagement leaders were fostering even more than they had ever done before. Secondarily, one of the negative things was really that risk of the virus itself. Our initial protocol for memory care was, let's ask the residents to stay in their rooms and we'll bring engagement to them. And there may be a few folks where their head tells their feet to go. And so if they're walking around, we'll just ask for them to come back to their room. Well, as soon as I started saying that, teams were looking at me like I had lobsters crawling out my ears because it just didn't work. The residents would not stay in their room due to cognitive impairments or memory impairments, and we needed to find a way to just stay as clean as we could during our business as usual, because the residents are going to continue to live life as they always have. If one resident in memory care does become positive with the virus, it is very common that it will spread very rapidly. With that being said, I'm so proud of Merrill Gardens that over 11,000 folks that we care for, we have a less than 2% positivity rate. And I think it was because of these really conservative protocols that we put in place, but there was lots of internal conversations about what's the risk and what's the benefits between being safe and loving a person with memory impairment. As I said, there were some very positive things that happened. In the beginning of March, all of a sudden, iPads arrived at a Merrill Gardens near you. And it was something that we had felt was, okay, we need to start video chats with their families because they cannot come in. And I think we all agreed with each other that, why weren't we doing this a long time ago? Our residents have always had family that was out of state or unable to visit the way that they wanted to, and so connecting through a screen is a possibility for a person living with dementia. And along with those iPads came some benefits that I don't believe that we understood would happen. It created an opportunity for some very individualized, person-centered engagement from the team with the residents. And Link Senior was a big part of that. Our pilot communities were utilizing Link Senior as a subscription, but because of the hashtag Activity Strong initiative, every Merrill Gardens had the opportunity to hop on and utilize Link Senior, and I started seeing teams have stories about using this product to connect with folks individually, maybe with expressions or challenging behavior, or in very small social distanced groups that we were cleaning those chairs as soon as the residents got up. Something else that I think that was positive that came from this was a hand washing schedule. In the past, we would just say, make sure you wash the residents' hands. But because of COVID-19, we knew this was one of the only tools we had in our tool belt. So we spoke about this almost like a continence schedule. Has the person been given the opportunity to wash their hands every 2 hours, and what does that look like? Sometimes it was simply incorporated into care. Sometimes there were some bookmarks before and after meals, but we did learn we needed to get a little creative to make this happen. Some teams actually rented the, when you have a porta potty at the fair, and then there is a rentable hand washing station. We found some of those popping up at our memory cares just because we did not have a sink near the dining room that was easy for the residents to wash their hands. Some of us went pretty old school, using hand towels with a rinseless soap, or even a pitcher with a basin to wash the residents' hands before and after their meals. During our weekly calls, we checked in with each other. Not just please wash the residents' hands, but tell me, how many times did Mary wash her hands yesterday? And what did that look like? I think that's a change that's here to stay. And the last positive thing that was pretty interesting that I don't think we expected to happen was that the calmer environment assisted the residents with the rhythm of their day. No longer were doctors and vendors coming in and out of the front door, and no longer were loud family visits happening in the room next to them. The residents just fell into a very easy routine. And oftentimes when talking to teams, I would ask, how was your residents? How was your week? They would say assisted living residents are really tired of being in the room, and memory care, it's business as usual. We're just happy being with each other in this time. And it's hard to see those silver lines in these clouds. Charles, next slide. So that was a little bit about where we are now, but let's talk about where we are going. So there's a few things that'll stay the same that will probably always stay the same. We can't say we're getting back to normal. We need to say we're getting back to new normal. And there are going to be some things that do need to change because this is ever learning and growing. As I said before, as a home office, we are attempting to create policies to keep our residents and team members safe, but it's almost like we're building the plane as it is flying. We are trying things, and if they don't work, by golly, we need to rejigger. So what will stay the same for now are the weekly calls, connecting with teams together. So regions can give best practices, and I can have an opportunity to actually see the folks that I am supporting. Maybe in the future, it may not be weekly. If we know that COVID-19 somehow gets under control, this could be something more like monthly, but never again will I go very long periods of time without being able to connect to those folks that I work for and support and love. And something that will also stay the same is assessing the risks per community of those protocol levels. This is a large challenge in COVID-19. We cannot say, dear 68 communities, everyone can let in visitors tomorrow. This does need to be evaluated per the community, per the outside community and what's happening with the virus, what the state, what the county says. There's lots of decision makers in this. And I think that we have to keep in mind that all of us are learning this as we go. So we're gonna work closely with teams and ensure that we make the best plan that we think that we can pull off, and then, golly, go from there. What will change? Our president, Tana Gall, said something that really hit me a couple weeks ago, where she said, we need to no longer work against the virus. I can tell you back in March, I would hop on a call and I would say things like, in a few weeks, when we open back up and I'm allowed to travel, I'll come to your community and we will have live dementia education. Well, it is almost August now, and that is still not the opportunity that we have. We need to stop working against the virus and work with the virus. Even if we're done with COVID-19, because to be frank with you, we're over it, it's not done with us. Something back to those weekly calls. Yes, it is a great opportunity for teams to get together to talk about what is specifically happening with the residents and teams regarding COVID-19, but I think that it could be so much more than that. On our weekly calls, we did ask about hand washing, but then we also did things for self-care. I gave homework to folks like go to each team member and thank them for what they've done today. Or this weekend, I demand you either take a bubble bath or have some ice cream. Whatever would work for you to say, this is hard, and I know it. And I thank you for swimming through these challenging waters that you have been dumped into. Sorry, going back over to what will change. So as we are working with COVID-19, I am going to start offering some optional dementia education via Zoom. These are new waters, my friends. I like to talk to teams specifically about, tell me what's happening with Bill. How can we find Bill's unmet need and ensure that his autumn years are wonderful? And so it can't be a recorded conversation, but it could be, as we are chatting together today, just giving some teams some education and working through some of our challenges. Something that will change is just 2 weeks ago, we did start to ask new folks to move into our communities. We'd had no move-ins since February. And I think that, as Charles said before, there is an opportunity. We understand that older adults have had decline due to the social isolation of COVID-19, whether it be physical decline or cognitive decline. And some people are out there and they deserve the support of memory care, and we want to support them. But by golly, just like we said, how can we bring someone to us not knowing where they have been, not knowing if they will self-isolate within their room? There are some ways that we will just need to work with and not against folks with a little bit of dignity with risk, knowing that there could be a challenge for the other residents in the environment. And lastly, we are going to tackle that ever big question of family members and visitors. How can we ask for folks to come into the community and visit safely? As of today, we really have not allowed that. And it's because we know that our protocols work. We know where our residents have been, and that's in community, and they're staying pretty safe. But we also know that they're missing their families, and their families are missing them. So in the future, we do need to jump this bridge, and we will jump it when we get there. So teams, that's a little bit about myself and about the journey of Merrill Gardens, and specifically our memory care, the Garden House, through COVID-19. I do want to say thank you to all of the champions that I'm here to support. I know that this must be very challenging. And when I say it's hard, that I've been in my house since January, it does not hold a grain of salt towards what you have been doing, keeping your residents safe, keeping your family safe. I thank you for supporting older adults in this way. You're the champions. So thank you for the opportunity to share a little bit about my story today.
Thank you, Marisa. Thank you so much. Hearing from you is fantastic, just to understand what it's been for you. I think that for all of us, it's been major changes. I love your idea of not fighting the virus, but try to see how we live with it. And I think that is where the bulk of our challenges are every day. And regardless of the industry, right? Like, for example, this morning I announced to my team that we're not going to be returning to the office till January, and Google announced 2 days ago that for them it was going to be in July. So this is a society thing, but there are definitely pockets in our society where it is even harder. Mm-hmm. And like you said, Melissa, what I lived through is probably a grain of salt compared to most people in the audience. So thank you again, Melissa, for sharing this. And on to Jill's presentation. So Jill, again, thank you for joining us. And I will let you take over your presentation.
Hey everyone. My name is Jill Mchenrick, and I'm the Connections Director at Juniper Village at Brookline. It is such a pleasure to be on this webinar with Melissa and Charles and all of you hardworking activity professionals, and I thank you all for allowing me to share my story. So a little about me and the community that I work in. I work for a Juniper community. It's a CCRC located in State College, Pennsylvania. I've been working as the Connections Director there on our campus, so I oversee engagement programming for all levels of care, from independent living, assisted living, memory care, skilled nursing, and short-term rehab. And I initially started as an activities assistant, then was promoted to director, and I also have my personal care home administrator license. So next slide there, Charles. I'm gonna tell you my story more in a timeline of how it unfolded for me in the community that I work in. So for us, we started hearing, much like Melissa said, about Seattle, and I'm sure all of you remember on the news hearing about the Kirkland community back in February. For us, we are lucky where we're located. It didn't really hit us until March. Our executive directors had talked about it most of the month of March, saying we would wait until a positive case happened in our county before we shut the doors. So that day came on March 20th, and we immediately kind of started our flu protocol. Like Melissa said, we already had in place our flu protocol. What do we do when a resident has the flu? We start socially distancing our buildings, no crossing between buildings. We started doing smaller groups and such. We did that right away in March. We did then on that day close our doors to visitors and outside partners. It was very hard, especially family members. Much like Melissa said, there was a lot of doubt from our family members. They felt it was a little extreme. We heard stories like, what if my parent forgets who I am if I can't see them every day? Those kind of stories that I'm sure a lot of you can relate to. We also, by turning away our partners, that was really hard for our programming. A lot of our programming at Brookline relies on outside partnerships, presenters, performers. So that was a really hard time turning away our volunteers. That really took a big hit to our programming schedule. That was a big change. Starting in March, of course, we started associate new protocols for tracking our temperatures daily. Our nursing director had an idea. She was concerned that associates wouldn't be washing their hands enough, so she put a stamp on our hand and we were required to wash it off at the end of the shift. That's how we checked to make sure our associates were washing their hands. Come April, I call April the month of a lot of changes. I think every day some new policy or new protocol was put in place. It kept our heads spinning. One day we could do this, the next we couldn't. Starting in April, is when we started isolating our residents to their rooms or hallways specifically. So we started one-on-one group programming in their rooms or hallway programming. That's when we also started doing our FaceTimes and Zooms. We were so lucky to be able to get more technology. We were able to get iPads for each of our activities assistants so that every person on the floor was able to have an iPad. That was so key and crucial for us. Starting in April, we began associate testing weekly. So we started testing all of our associates in all of Juniper communities for COVID-19 once a week. That was a big undertaking for our associates and for our communities. So after we started testing people, is when we decided we were going to make a bubble for our residents. We decided that we were going to close our doors. No one was going to come in or out, and that included associates. This was a tough decision to make, but we have a really strong team of associates. Most were willing to stay between 7 and 28 days. So we knew that the staff were the biggest risk to our residents coming and going. So this was a hard decision, but we had a really great team. I myself lived in our community for 14 days. And it was a great social experiment to know what it's like to live in a senior living community. We have a lot of fun stories, a lot of camaraderie between the residents and staff. We live in rooms right next to residents, and we have a lot of great stories. So the month of April, we lived at work, and that was a lot of fun. The scary thing about that was we broke our communities up into what we called cohorts or villages, meaning the same staff worked in the same hallways. This would make it easier for contact tracing. If someone would test positive, we would be able to narrow it down to a specific hallway of who we needed to isolate or retest. The struggle with that for our programming was I did not have enough activities assistants to have one in each cohort. That was scary to me as the director, the thought of there being whole hallways of residents who may not get any engagement opportunities. So the executive director and I talked, and we decided to cross-train our other associates to be activities assistants. So myself and the dining and housekeeping supervisors trained each other's associates to do one-on-one programming, FaceTimes and Zooms, all those great things, as well as our activity staff learned to make beds and clean rooms and help serve meals. We basically created universal workers to help us get through that month. So that was the month of April. Cross-training our associates was so important. When it comes to May, a lot of it just stayed the same. We weren't living at work anymore in May, but we had developed some good routines for our staff. We got used to our village cohorts. I went in the same door every day. I didn't go to other hallways. I worked in the same 2 hallways for a good 3 months here. So May, not too much changing. I was asked by Home Office in May to be a part of a group to come up with reopening criteria. So we start the discussion in mid-May about what reopening would look like and what we would need to make it successful. So I was on the committee specifically for programming, and there was a lot of talk about safe programming and how we would do it. So come June, we started implementing those phases. Juniper called it a pathway forward. And it comprised of 3 phases, red, yellow, and green. And by June, we were lucky enough, we still had no residents with COVID-19. So we were able to move to what we called the yellow phase, which was allowing our residents out of their room to do small group programming within their cohorts and communal dining, where we have 1 resident per table in the dining room. So that was June. If you want to skip ahead to where we are, the next slide there, Charles. Where are we now? I'm happy to say here in late July that among our community, we are still COVID-free for our residents, which is great. I'm so proud of that. We've worked really hard. However, this doesn't mean that we haven't had any losses among our residents. We've noticed a decline physically due to a lack of walking as much as they used to. Our campus is pretty spread out. Our residents are used to walking a good distance to programming and dining rooms. They weren't doing that anymore. The lack of exercise, the lack of physical therapy had played a really big part. We were seeing more falls. We also noticed an increase in delirium. It's like our residents had cabin fever for a little while there. Residents who normally weren't having any cognitive decline were, having delusions, seeing hallucinations and things like that, which were kind of concerning. And the fears that our family members had of them not recognizing their family, that did come true, unfortunately, for some of our residents. We did start in June allowing in-person visits with family members outside. They were supervised by myself or one of my team members. And I remember the first one I took out, the resident didn't recognize her son. Now he grew a big beard and had very long hair, and he had a mask on. So there was a lot of factors that contributed to that. But I know it was upsetting to the family member and myself and for the resident to not recognize that person. So those fears did come true. While we still remain COVID-free, we did have some other challenges. I mentioned earlier that we started the phases, the red, yellow, and green. Currently, our community is between yellow and green. Because we have not had any positive cases, we probably will move to green this week. However, we do live in a college town, and Penn State University is gearing up to bring about 40,000 more citizens to our town within a month. So that does bring some concerns for us in our senior living community. So we may be green for now. We are still doing weekly testing of our associates. So the hard thing about that is each week is like a new week. This week, no staff tested positive. However, next week they could. And if we do have staff members testing positive, that means we could be bouncing back to the red phase. That has made some real challenges for reopening. I know Melissa and Charles both said reopening has been harder. That is a fact. It's hard to predict where we'll be next week. How do I plan group activities if I don't know if they're going to be in their rooms? Are we going to be allowed to have groups? But also my activity team has really acquired more responsibilities. Myself and one of my activities assistants were pulled to help in nursing. We both got recertified as medication technicians. 2 of my other associates have been helping with every meal. Supervising family visits takes a lot of our time. Sometimes we have 6 or 7 family visits a day. That's more than half of our shift. So as we are now being required to get back to a more regular group programming, it's hard finding the time to do everything. So I had an idea as we reopen. I told our executive director, I really want to know what the priorities are for our residents currently. So we surveyed our residents, and it was an open-ended question. It wasn't multiple choice. We said, list the 4 activities that you miss the most, the things that you want to do. And you'll see on the slide there, and this is in order of the most votes. They miss seeing their family, they want to do exercise, they want to socialize with their friends, and they want to get back to worship service. So those are the 4 things in my mind that I feel I want to prioritize and try to find ways to do safely. We did start our family visits, that's going well. We are now back to doing exercise classes, and our therapy department is up and running. As of this week, going green, we're allowed to have our happy hours and our social parties again. We're looking forward to that. In the past, we were just doing carts, which I know you and a lot of you on this webinar have done some amazing carts, I'm sure. So we are still doing that. But those carts, what's nice about it is they can be flexible. We could use it the same cart and its materials for a group activity. And if need be, tomorrow when we have to go back to the red phase, we could do it for one-on-one group. So that's helpful. Charles, if you want to move to the next one. In the next 1 to 3 months, where are we going to be? Our goal is always to work towards green. Of course, some of the factors are out of our control, such as the number of cases in our community at the time. So we're slowly reopening, and our goal has always been to have safe and happy residents. So we're listening to them on what they want. Every day we kind of talk, the leadership team here about, the pros and cons of the decisions that we make. What's in the best interest for our residents. Much like Melissa said, there's some great things that we've developed over the last few months that we're going to keep going forward. The increased virtual programming. I love that each of my assistants on each shift is able to have their own iPad. It really opens up the opportunity for us to do more virtual programming. And now that we can do groups, we're going to be doing even more live streaming events, such as worship service performances, etc. The social distance programs, that's probably going to be our new normal. We did measure and tape out on the floor where we can put chairs and tables for certain group activities. The associate cross training has been so vital. I've always kind of said it that, it wasn't until we made other departments help that they realized the importance of activities. We all know that activities are important as activity professionals. Sometimes the other departments don't realize what all we do. Cross-training associates has been so great to get that mutual respect, as well as getting buy-in from every department on the importance of keeping our residents active and engaged. Our housekeepers, our dining, and our activity staff are all working together to keep our residents engaged. And we're going to keep cross-training. We're going to just keep following our phase of opening requirements. We have a nice grid that we follow. There's certain criteria we have to meet to be able to be in a certain color phase. Like I said, we are meeting criteria for green in my community, but that could be different for each level of care. Our skilled nursing is still pretty much in the yellow, and that could change even on our own campus. The building could be in its own different phase. We started doing daily family email blasts and resident email blasts. We found that to be very helpful. Our family members have loved the daily updates. Sometimes it's as short as just 2 sentences saying, there's no new cases of COVID. There's no cases. We have enough PPE. Please let us know if you have any questions. So we're going to keep those up. We did cut back just last week to 3 times a week, but I do get emails on the days off of family members asking how everything's going. So we're going to keep up that communication with family members and residents. We had vowed early on that we'd be fully transparent with our family members about COVID-19. We weren't going to try to cover anything up or hide it. So we have been doing that. And virtual family visits have been a huge hit. Like Melissa said, why didn't we do this sooner? This is great. A lot of our residents do have family members out of state anyway, and this is a nice way to connect with them. So we are going to keep that up. Virtual programming, I know I mentioned before, Juniper actually created its own website called Virtual Connections, which is a great collection of online free website content that you can use for programming. It has everything from virtual live stream tours, trivia games, live streams of performances. You can check it out at slvirtual.com. And I think we're going to keep up a lot of one-on-one programming. We did find there's some residents who didn't usually come to groups prior to COVID. And we've noticed a real change with them in a positive way. Some residents don't necessarily benefit from large group programming. So having that person-centered plan in place for each resident and doing the programming that meets their interests is important. And I think that's all I have to say. I appreciate everyone letting me share my story. I really hope some of you can relate to the things I've said.
Thank you very much, Jill. I mean, the dedication it must take. This is for me an example of passionate and dedicated people, willing to spend 24 days living on in your community. The one thought that comes to me is how lucky your residents are and how thankful some of them must be. And I'm sure that all of us, all of us, I'm not included in that, but I'm sure that many of you have thankful residents because some of them must understand the sacrifices that you are personally going through. We had obviously tons of questions given how relevant and fantastic these presentations were. Jill, I just had a quick question, which is actually just both Jill and Melissa, if you want to share a little bit of that. Family connections with family virtually, on one hand, like I agree with you, has been a blessing, right? It helps us connect our residents with whom they love, especially out of state. But we know also it can be challenging from educating the family on what can be done or not done and so on in terms of timing, right? Sometimes there's only one or two staff members for a number of residents. Guidelines or suggestions that you can share to help us navigate that.
So if it's okay, I'll start, Melissa. We did set up designated times and locations for family visits. And also for Zooms, what's nice about having the iPads is we can text message family members. So we're finding a time that mutually works for both staff members and also for the family members. And everybody's been pretty accepting of that. For in-person visits, I started using a Sign Up Genius link, and I established the times available, and that's what it is. And we have them on various days and different times. So there's usually something that works for everyone. I haven't received any complaints from family members yet. We haven't really diverted from that plan. We have between 6 and 8 blocks for each building per day, which is a lot. So, but what's nice about the family visits is we do get full department help with that. The business office helps, our nursing department helps, everybody helps. So it's been really great. It's going pretty well.
Okay, Melissa, I'm going to ask you the same question, but just because, Jill, you referenced a couple of sites and a lot of people are asking about it. So the survey tool that Jill just referenced talked about is Sign Up Genius, and I know a lot of communities doing that. The other tool that Juniper developed, which is free for everyone, is called Senior Living Virtual, and it is free of charge, and I highly recommend it as a resource to find out about other programs. Thank you very much, Jill. Melissa, do you want to share a little bit about your guideline when it comes to family interactions, whether it's virtual or in person?
Yeah, thank you, Charles. I think that we needed to take a very individualized, person-centered approach for memory care. Some folks did great with that visual video call piece, and other residents, it confused them more greatly. The teams would say that they would put the iPad up to their ear, believing they needed to use it as a phone, or that would frustrate the person saying, why can't I get to them? Why are they not here? Please come inside. And that would go for window visits as well. Sometimes it was a great thing for the resident, and other times it was much more upsetting for them. So it was very individualized, speaking to the family member about how the feelings of the resident was affected by that call. For the scheduling piece, we just talked about it as if it was a transportation program, exact same way,
okay.
Right? So you would usually need to call the front desk and ask for a time slot. No one else is signed up for that time slot. And so some family members do have standing time slots, and others are able to just organize that through the front desk.
Cool, thanks. Thanks both. For me, I know it's a topic that we've mentioned several times, but I can't emphasize how important it is. I'd love if one of you or both of you, if you want to talk a little bit about self-care. What has your company done to make sure that your staff has all the tools to take care of themselves first? And like we said, this idea of putting your oxygen mask first before the others. Any ideas or anything you'd like to share further on that?
I'll go ahead and take that one first. As I said, I'm very proud to be with Merrill Gardens during this time. Very early in March, we released more sick hours. If someone needed time off for COVID-19, not necessarily if they were sick, but if they were having challenges with childcare or things of that manner. We also increased overtime to double time almost immediately, understanding that many folks do work in 2 different care communities, and we would like for those folks to stay in our care community and be in our family. So any way that we could promote that, we did. But for the self-care piece, I think that it's important to just be honest. Folks in engagement have sparkles coming out our eyes. That's just who we are. But it is okay in this moment to say, I am anxious, I am scared, I am really tired of just running a sprint through this marathon. And so my suggestion would be is grab a mentor, whether that be someone in a support role like myself, whether it be someone at your community level that you can hug onto, and be allowed to have those honest conversations by saying out loud, today I'm tired. Then at least you can express those feelings, get them out, and then remind yourself of, why do I do this? Personally, I do this because I love older adults with memory impairment and believe that they have the same rights as every other folk. And so even though I am tired today, if I center myself in saying, Gertie needs me, then I'm going to go and be with Gertie for the day, and then be able to go home and just be honest again with my feelings. So get a mentor, talk this out, and it's okay if you're not okay.
Thanks, thank you so much, Melissa. I do want to share one thing, which Jill, you forgot to mention what's your new nickname.
Oh yeah, I do have a new nickname. I'm called the Jill of all trades. So while I'm the activities director, I also have my administrator license. I also got fire safety certified, and I'm now a med tech, so I'm working my way to being able to work in every position at the community, and I'm happy to do so. I'm willing to jump in wherever, and what's great about the activities team is we are very flexible people by nature. And myself and my team are all willing to help in wherever. So yeah, the Jill of all trades.
I love it, Jill. I mean, for me, honestly, I think that as hard as things can get, and I want to acknowledge some people are just not returning to work because they're scared, they cannot, right, take the risk because they have older adults at home. Like, they're really difficult times, but as difficult as they are, we're definitely learning, and I believe that there's going to be great things coming to us. Like, was shared by the presenters today, this concept of universal workers, and also the fact that we're getting help from other departments. Weren't we begging for that, even 5 months ago? And I know it's not the case for everyone, but hopefully that will become the standard of us understanding as organizations that activities is not only about activities. Engagement is not only about activities. There's a whole team perspective. So with that, again, thank you very much for taking the time, Jill and Melissa. For me, having professionals, and actually not professionals, leaders like you come to these webinars is very meaningful. So I want to thank you for taking the time. And I hope, well, I'm sure that everyone on the line today has learned something. So I'm going to quickly share, and this will be part of our follow-up. We will send a presentation today. But if you have questions, Melissa and Jill, have volunteered their time, and they've also said that they were okay for people reaching out if we had questions. With that, I know there's been a number of questions about the resources that we've had discussed. I do want to share the fact that Activity Strong is here to, sorry for the pun, but help you stay strong. And with that comes education that will be coming up. There is also a Facebook page where all of the resources that were shared will be highlighted as well. So with that, again, thank you. There's a couple of things I want to mention, which is that as we continue to navigate this pandemic, COVID-19 and its challenges, the best way for us to improve is obviously to think about where we are, but also communicate, collaborate. And I can't tell you how much I am amazed by the story that we see every single day, whether it's on Activity Strong, the Facebook page, or other pages online in Facebook, like how creative you are. Like, it's amazing. And so, collaborating is really important. Hearing from leaders like Jill and Melinda is one thing, but also, please take the opportunity for our webinars that we do twice a month now. I highly encourage you to consider these. I know that the next one is in a very short amount of time. It's next week. But the Validation Training Institute is one of the best organizations to help us understand how to improve communication and quality of life of our residents. And Odile, besides the fact that she's French like me, so therefore she's fantastic, she's also somebody who has years of experience as a music therapist, a CTRS, has worked in a number of settings, including memory care and the long-term care settings. So with that, last time, Jill and Melissa, thank you so much for taking the time to do this. Megan, I'll let you cover the last piece of the discussion. And again, thank you everyone for joining today. It's a pleasure, as always.
Thanks, Charles. And you can go ahead and end our recordings for today. I did want to let everyone know that the CEU survey evaluation link is now in the chat box in the Zoom webinar room. You're also going to be receiving an email later this afternoon